Hey everybody, how are you? I have not been on here in a hot minute. It has been a little bit. We have been super busy and life got in the way. But I'm on here today to give you my 9-month, next week will be my 9 months explant update. And so I'm just going to go ahead and do it today. I happen to have the time and I happen to have no dogs barking and no husband talking. So I wanted to come on here because I have gotten so many messages literally daily about people who want to know about breast implant illness, who want to know what symptoms or that they match mine or whatever the case may be, literally daily, sometimes 3 and 4 times a day. And I am so super grateful that all of you feel comfortable enough, 1, to reach out to me, 2, to listen to my story, because I feel like everyone should hear it. Because maybe it's not you that's suffering. Maybe you have a friend who's suffering. Maybe you have a loved one who's suffering. Maybe you're thinking of getting implants and this would be the reason you didn't. And I've had multiple people tell me that same thing too. So I just kind of want to backtrack just a little bit. First of all, continue to thank you. Thank you for following my channel, for listening, for being a part of it, even if it is for the reason that it is. I feel like God put me on this platform for a reason. I had to go through my journey for a reason because He knew that I would share very candidly about my journey, my healing, and how I feel about breast implant illness and the fact that it's not anyone's fault. So I'll talk about that in just a second because I might get some backlash for that, but it makes sense when I say it. So, okay, let me backtrack. So I had my implants out. I'm going to make this really brief too. So I got my implants out last year in April, I think, April, 9 months ago, and woke up feeling better. I know people think it's crazy. I know people think it's in your head. I promise you, when you have brain fog to the point that you don't remember how to go get your kids and you do it every day at the same school for the last 6 years and you get there and you don't remember how you got there, that's serious. When you wake up, and I remember sitting in the chair because I was in the recovery chair and my dad and my husband were there, and I literally felt lightheaded. Like not weird lightheaded or sick lightheaded. I felt like a weight had been lifted off of my head. It was the most incredible feeling. I will never, ever forget it. Then I remember my back didn't hurt. So I had been severely suffering for probably the last 1.5 to 2 years. It was a very gradual progression for me. It started out with stomach issues. Then it was sinus issues. Then it was skin breakouts. Then it was sleep problems. Then it was aching. It was joint problems. Then it was back pain, and we're not talking about like joint back pain. Like it was this intense, could not get it to go away back pain. And then it became serious. Like it wasn't just minor pains that I was like, oh, I can deal with. Oh, my stomach hurts all the time. Everything I eat makes my stomach hurt. It was, I can't eat certain things. My skin itches when I eat certain things. My kidneys were starting to become dysfunctional. My liver was dysfunctional. My hair was falling out. I remember I had a bald spot right here. And I remember the day that I realized something wasn't right, that it was more than just the random doctors telling me that something was wrong. Oh, it's a stomach issue. Let's give you these pills. Oh, it's your kidneys. Let's test this. It's your skin might be from gluten. Your eyes going bad. So I went from wearing glasses every single day and needing them. I could not see to now, on the occasion when I eat bad, I do need to wear them again because my inflammation comes up. And so then my eyes inflame and then I can't see small writing. Now I can see to drive and things like that. But I had gotten to the point that I needed my glasses all the time. After surgery, I haven't needed them. And so, it wasn't one of those things that my doctors were like, as a whole, we see a problem. It was pieces and parts of different things. So my back had started hurting. I was seeing a chiropractor several times a week, trying to get it, not to hurt. Sorry, I have something in my eye. But this back pain, I woke up with no back pain. And we're talking very specific spot, very specific pain. And I worked out and ate great through the entire process. So I knew it wasn't things I was eating. I knew it wasn't things I was doing. And I even laid off exercising hard thinking I was hurting myself. No back pain when I woke up. Came home. I felt great. I remember talking that day. I still remember that day. And I have had multiple surgeries in this time frame of being sick. And I remember that day talking to my dad and telling him I needed to stay awake for him because he was sitting with me while my husband went to get our kids. I mean, craziness, the craziest things I remember, all because my brain felt clear that very day. And I have been told, let me backtrack again because I kind of got off topic. I have been told it's all in your head, a psychosomatic. It's not really real. I've had friends husbands. I have had lots of people say, are you sure? Are you sure that's what's wrong with you? And I'm like, no, I'm not sure that's what's wrong with me, but I do know it's my last resort. It is the only thing that I haven't fixed in my body that could be wrong. And it was an autoimmune issue. So it wasn't just my stomach. It wasn't just my back. It was my entire body. My feet were swelling to the point that my mom was like, what is wrong with your legs? They wouldn't fit in my shoes. My rings didn't fit. I woke up every day and I couldn't bend my hands. I mean, you name it. I had metal toxicity. And if you've watched my previous YouTube videos, you have seen that I've had a multitude of things. But I remember, okay, let me backtrack again. I'm so fired up today about this. So I remember the very day that I was fixing to go cut my husband's hair. And I remember like running my hands through my hair and a handful. We're not talking your hair's been in a bun all day for 3 days and there's just a handful because you've lost hair in that bun and it needs to come out. We're talking hair down, no reason I should be losing handfuls of hair. And you could see my scalp right here through on both sides, like horribly. And I was like, I'm going to be bald. All my hair is going to fall out and I'm going to be bald. And God love him. He said, it's okay. We'll buy you a wig. And I was like, but I don't want a wig. I don't want to lose my hair at the time, 42 years old. 41. I'm 42 now. That's terrible. I don't want to lose my hair. But I remember just clumps of hair falling out. My nails wouldn't grow. They would break and peel. And I mean, you name it, my body was freaking out. So fast forward now, I get my implants out and there is a level of detox that you have to go through. And I'm not saying I'm not still going through it. It could take 6 months to a year. But 1 month into it, I felt incredible. I was asking my doctor, I was like, when can I go run again? And he's like, easy girl. You just had surgery. And let me explain real quick. When you have that kind of surgery, so if you have your implant and your tissue, your breast tissue on the top, and then you have your chest wall and your muscle wall, you need that to adhere back to itself. Can you see that? Because you put an implant in here. And then when you get it taken out, you have all this space. And you need that to adhere. So mine was still in the process of doing that. And so he was like, you need to relax. You can walk. Don't shift around. And I was the person who wore sports bra for 10 years. They said, if you wear a sports bra to bed, they're going to look good in 10 years. And I'm like, sold. I spent too much money on these things for them to start sagging when I get 50. So I had no intention of taking mine out. I was happy with them. But once I started swelling and getting to the point that I was uncomfortable, I knew something was wrong. I had weight I couldn't lose. I had this very uncomfortable feeling. The sweat even around my implants smelled different than, say, like when I would sweat from working out or whatever. And so I just knew something was off by this point. This is last year. So I went through this detox, and I still think there are days that I do. If I eat bad or if I'm not drinking enough water or whatever, your body constantly detoxes. And so when you have had this autoimmune issue, somebody's walking up my driveway, so hopefully my dogs don't freak out. But when you've had this autoimmune issue, it takes a minute for that to get back to normal. But here was my philosophy. My body did not start out this way. Before I got my implants, I didn't have this problem. I didn't have any issues like this. And so I knew it knew what to do. I knew that it knew how to get back to normal. So I just knew it was going to take a minute, and I was patient. I was very, very patient about how we were going to get through that, what we were going to do. And I have been asked multiple times, did you do the cupping? Did you do all the detox pills and all that stuff? I didn't. I just knew. I have a heater going. I'm sorry. It's blowing my hair around. I just knew that my body would figure it out. If I treated it well, if I rested it, if I did the right things, it would figure out what to do. And it has. It's healed itself. I am in such better internal shape than I was when I was in my best physical shape, if that makes sense. Internally, I feel good. I was standing on my porch the other day, and I forever, while I was sick, my intestines hurt all the time. They were so inflamed. No matter what I did, no matter what I ate, they just hurt. And I was standing on my porch the other morning, watching our dogs run around, and I was like, I don't feel the need to suck in my stomach because it hurts so bad, because it's so inflamed. It just feels like it's constantly bloated and hurting, and it hurt to touch my intestines. Like if you touch your stomach, it hurt to touch. And so I was like, that is such a strange realization that you don't realize how bad you feel from something until you feel better. And like I said, we were super healthy through all of this because I knew if I fed my body well, then that was the one thing I could control. If I worked out, that was the one thing I could control. But here's the thing. My body was in such fatigue all the time that I was just harming it by working out so hard. I was not doing it any favors. So at some point in this 9 months, I got food poisoning. And I swear to you, it was like an exorcism. I got food poisoning. I didn't know it. I was super sick the next day. By that night, so 24 hours later, my body literally released everything that it had in it. And I hadn't eaten, so there was nothing really in my body. But I swear to you, all the bad that was sitting in my gut came out with it. It was an exorcism of some sort that I have never had. And I have been sick. I have had stomach bugs before. This was so different. And I feel like it was my body saying, okay, we're done. We are done with the crap that's in it. We're getting rid of it. I felt like a different person the next day. Obviously, I was still a little weak from being sick, but things changed. It was weird. All of my swelling went away because I still would swell. I mean, I was still detoxing. I had years of toxic material in my body that needed to be gotten rid of. So it was the strangest thing. And I'm not saying everybody does that, but I just felt like for me, that was kind of like the final straw. So this was some time ago. It was in October. And I have felt great since. I think about this every day. It's not in the forefront of my brain, but I just think about like when I eat a cracker that has gluten in it, or I eat something that has dairy in it. I think a year ago, I couldn't do that. The joke in my house, if you've listened to my previous stories, was I literally would eat a plate of ice because it was just nothing. It was so little. And I told my husband the other day, so we had started working out again and eating right again. We kind of took a little hiatus because, I mean, sister was living it up, being able to eat all the fun stuff that I could. I had not eaten ice cream in forever. I had not drank like a glass of wine without hurting, physically feeling like someone had beat me the next day, or what I think that would feel like. Every cell in my body would hurt. And it doesn't do that anymore. And I'm not saying that was like the, pinnacle moment, but it's just nice when you realize that you can live like a normal person. Where we go to eat dinner or what we do is not dictated by my health anymore. And I am not the exception. I'm not any different. I didn't do anything any more special than the next person who's trying to detox. I still work out. I still stay very healthy. We do have fun treats. We do eat fun things. I can eat cheese dip now. You better believe I eat cheese dip and chips. But it's not on the regular. It's not something that I do all the time, but I do get to reward myself now and not feel bad for it. So it is kind of on my brain all the time because so much of my life was a conscious decision before. So much of my life was, is this going to make me hurt? Is this going to be bad the next day? Am I going to swell? Can I take ibuprofen for a headache? Because my kidneys, when you have kidney disease, you're not supposed to take ibuprofen. It's terrible for your kidneys. I didn't know that until I had this. And then they're like, you really need to be careful. Liver dysfunction. Your whole body freaks out from a foreign object. Let me make that clear. I think any foreign object, if you're not taking anti-rejection medication, which you don't for plastic surgery, your body can reject it. Period. The end. That's how it goes. So on to my next. I am 9 months next week. I feel great. And at this point, so much about how I felt years ago was I couldn't control how I felt. So I'm going to control my weight. I'm going to control what physically I look like, because internally I'm a wreck and I can't control that. So it was all about being skinnier, healthier, abs, all that stuff. Now that I feel good, it's just about being healthy. So yes, we're eating healthy. We got a Peloton for Christmas. I run still sometimes. It's kind of cold right now, so I don't run a lot. I still do weights. I still am doing my Beachbody On Demand. All the things that I love. But I don't feel bad on the inside, so the outside reflects that. So am I the tiniest I've ever been? No. Do I have a whole bunch of abs? No. They're there, but, they have a little bit of cheese dip layer on top of them. Nothing horrible, but I feel good. That's the point of this, is I feel great. And that's what I can't get across to everybody, because I was told multiple times, you have, when you get implants, and the only reason I can speak about those is because that's all I had. I don't have anything else that's not normal in my body. Besides a few pins in my feet that I can't help. I had to pin my feet together. That was a completely separate situation from my implants. Had nothing to do with that. But, I feel so good. And that's what I can't get across, is that I was told multiple times that you would have an emotional attachment to your implants. And I was like, no, boobs don't make who I am. If my husband is happy with me and the fact that I'm so much healthier makes that better, then that's all that we can ask for. And I do. I am so much better. So, I didn't have the grieving. I don't look at mine and go, oh, I wish I had implants again, because I feel so good. So at this point in my life, it is just about feeling good and feeling healthy. And then teaching my girls that outward vanity is not worth the internal struggle that I got from it for years and years and years. And they saw that firsthand. They're 13 and 11. So they saw how much I struggled with everything and how much I don't have to now, how much I can just live a normal, healthy life and do things with them and not worry about the consequences later. So here's my last point. Clearly I have some ragged hair today, but here's my last point. So I read an article about the breast implant industry and how we're not being informed about the dangers of breast implant illness. Two things that I have to say about this, and please don't backlash me, because I 100% believe that any foreign object in your body is going to freak your body out. But do I blame my doctors or anyone else for me getting sick? No, I don't. I chose 10 years ago, almost 11 years now, to get implants. I was educated at the time. I felt like I knew what I was getting into. Was I nervous? Of course. I was going in for a voluntary surgery that wasn't necessary, really, in hindsight, but I felt okay with it then. So do I feel bad about it? No. I loved them while I had them. I enjoyed them. Do I feel like someone should have told me anything different? No. I signed waivers. I feel like I was informed. I feel like my doctors told me every risk at that time that there could be. Do I feel like they should have told me that your body can reject these? How are they to know? Because you can line me and 10 other women up, and you're not going to know if my body rejects it or her body rejects it or any of our bodies reject it. You just don't know. Doctors don't know everything. They're you and I with a higher education in the field that they're specialized in. That's it. Doctors are not here and we're here. They just have different training. And so do I feel like it's up to people like me to inform other people about my experience and the dangers? Absolutely. But do I feel like every woman who has breast implants or is going to get breast implants should not? No, that's your decision. If you are educated about breast implant illness and you go with it anyway, you go forward with getting surgery, then many prayers to you that you don't get the same thing I did. or to the degree I did. Maybe you get migraines from yours, but your breast implants are worth your migraines. That's up to you. That's not for me or anyone else to decide. So first of all, do I blame anybody? No, I don't. I don't blame any doctor for anything. And here's why. Because when I was sick, I had so many problems, from head to sinus to stomach to throat. My thyroid was inflamed and my throat swelled up. I went to all the specialty doctors. I went to everyone I should have gone to. I even went to a functional medicine doctor at the very end. He was my last resort. We paid a crap ton of money to this man. And do you know what? I think he's wonderful. Don't get me wrong. I think he's wonderful. But he couldn't have fixed me. He couldn't have fixed what was wrong with me, because what was wrong with me wasn't for anyone else to fix. My body did not like my implants. And when you have implants, your body attacks the capsule. Your body builds a capsule or scar tissue around that foreign object, and your body starts attacking it. And so, did any of those doctors relate my stomach with my boobs? No. Did they relate my eyes going bad with my boobs? No. I don't blame them for that. I don't expect anyone to go, you have breast implants. That likely is why every part of your body is freaking out. Now, do I think that because we as women are more educated about it and surgeons are more educated, should they educate people when they come in with problems? Yes. And I will tell you, I have told my nephrologist that this is what happened and that I believe they caused the problem. He doesn't believe it, but do I think it's his responsibility to research that? Absolutely. Do I think that my rheumatologist, who called to check on me recently, should research that rheumatology issues can be because of implants? Absolutely, I think he should research that, because I feel like my joints were inflamed to the point that they hurt all the time. So do I feel like it's their responsibility to stay up with the times? And do I feel like they should say, maybe you have because you have breast implants, maybe this is the problem? But if they didn't do that to me, do I feel animosity towards them? No, because maybe they've never had a patient who has had that problem like me to come in to see them and them say, this is the problem. My functional medicine doctor, who looks at your body as a whole, who saw every inch of my blood work, from pieces of hair to stool to saliva to, I'm surprised they didn't take earwax, for God's sakes. Every part of me they looked at, and still they didn't put the fact that I had implants together with the fact that my body was freaking out. I had to be the one to say, hey, have you ever had a patient who's had breast implant illness and had a problem and had to get it taken out? And they're like, oh yeah, we've had a couple patients and they've had great results. But do I blame them? No. Do I think that maybe they should have said, hey, before we take all your money, you have breast implants. Maybe you should do some research on breast implant illness, because they've had patients who have done it, who, gone through the surgery and gotten better. Do I feel like they should have informed me? Probably, before they took my money. Do I blame them? No. They educated me. They took care of me. They did all my blood work to show me what was wrong with me. I still have one more blood work I can do if I want. I feel good. I don't feel the need to do it right now. Maybe if it's necessary at my year mark, I will, to see from a year to a year, 1 year to the next, how I did. But all my point is I don't blame anybody, and I don't think anyone else should, because when you go to a specialty doctor, they're specialized in their department, for lack of a better word, their specialty. So if it's a foot doctor, do I think my foot doctor should have said, hey, you have breast implants, it might be affecting the bones in your feet? No, because when you think about it, that's absurd. But then when you stop and think about how your body is trying to remove this foreign object. So I think that can happen with any foreign object. The reason I think it doesn't happen with transplant patients and things like that is because they get anti-rejection medicine. We don't get anti-rejection medicine for boobs or nose jobs or any other implant you have put in your body, any foreign object you have put in your body. Your body can reject it, period. And no one knows if your body's going to reject it compared to your neighbor. So that's kind of my soapbox moment about that. I don't blame anybody. I don't think that all doctors are responsible. I do think, and here's the thing about plastic surgeons. Are they going to tell you that having that can cause illness later? They don't know that. So I had someone yesterday ask me, if I get this or this implant, I want to do everything I can to prevent getting breast implant illness. You can't. You don't know what your body's going to do. You don't know how your body's going to react to it. So your body forever may be fine. I have friends who've had theirs for 20 plus years. And maybe they have mild symptoms, but they don't relate it to that because it wasn't an all-over sickness like mine was, or some other people who are truly dying because of this, because their body is just shutting down. And it's expensive to have them taken out. If insurance doesn't cover it, I have not met one case, maybe one on this group that I follow, that insurance has paid for it. It's not a medical issue at this point, and it's a voluntary surgery. You chose to put these in. Now, let me back that up. There are people with breast cancer who do not choose per se that route. They choose to have their breast implants put in, but it's because of their situation, and I totally get that. But again, you chose at the time to have that reconstruction, and I think it's wonderful. I think it's such a blessing that we have that option. But no one can know if you're going to react or not to it. So you just have to listen to your body. You have to know your body really well and be very persistent. That's what I'm going to leave you with today. Be persistent. Be adamant. Be knowledgeable. Know what you're getting into. If you're going to have them, knowing that this exists, fine. But also, be knowledgeable about your body beforehand and after. So once you get them, then realize there may be subtle things that start happening. Keep note of that. Make a little journal or whatever if you notice things. Sometimes people get sick within 6 months. Mine was over years of time, but I think the only reason mine didn't crash like some people do is because I just tried to stay so healthy to control what I could control. So here's my last thought. Be persistent. Words are hard for me today. Be persistent. Be knowledgeable, and be your advocate. No one else is going to do that for you. All right. If you have any questions, you always can comment below. You can message me. You can Facebook me. There's lots of ways to get in touch with me. I am by no means an expert in this. I know my situation. I have followed many situations. I've had many friends go through this and have done well. But I'm happy to share any part of my story with you, from the good to the bad to the downright not fun. It just is what it is. But I feel like I was put in this position to share with you so that I could educate you for those who don't. So have an awesome day. Thank you for following me. And hopefully I'll have some fun content coming up that is not breast implant illness related, but I love that you follow me for that reason.